Hello everyone. Today's video is about vertical ridges on fingernails and why they might occur and maybe even what we can do about them. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So someone posted this question on one of my other videos saying, let's see here, I have a curiosity about vertical ridges on nails. I've read it's age or genetic. My mom had ridgy fingernails, and I've read it's a mineral deficiency. My fingernails have vertical ridges, and now I notice my toenails are starting to. What is your take on causes? So thank you for the question. So with vertical ridges on fingernails, I've thought about them over the course of time. Of course, they're thankfully not a debilitating symptom. I mean, maybe they are for some people, and if so, my apologies for downplaying that. But I think generally, unless you're a hand model or a foot model or something like that, then the ridges on the fingernails probably don't really matter a whole lot outside of maybe a little bit of cosmetics. But it is something that I've thought about since I began my naturopathic practice, because it's something that kind of colloquially in the naturopathic community anyways, functional medicine community, I suppose, has been looked at as a sign of possibly a mineral deficiency, as was mentioned in the question, or possibly a stomach acid deficiency, which could potentially lead to a mineral deficiency. So when I first started practicing, I kind of always thought of it as being more of like, oh, you might have low stomach acid, and I certainly noticed some correlation with folks who had vertical ridges on their fingernails and having low stomach acid when we would do a stomach acid challenge test, really simple test where you take a capsule of supplemental stomach acid, see if it with a meal, see if it causes heartburn. If it does, then suggest that a person maybe does not have low stomach acid, maybe has normal or high stomach acid, or if they feel nothing, then maybe it suggests low stomach acid. So just a simple, quick and easy test, and has really stood the test of time. A test that stands the test of time. That's pretty meta, I think. And I've used that in practice for many years and can be really helpful. So I do think that it does indicate something, but to what extent it's definitely related to stomach acid deficiency, I don't know, but I think it's a bit of a clue. I have had patients over the course of time that have seen a reduction in the intensity of their fingernail ridges. I've looked at lots of nails in my day, and with some folks it's just fairly subtle ridges. Some folks, they're really, really pronounced. Like you can actually see kind of like a whitening, like at the edges of the ridges, almost like snow capping a mountain. Quite poetic. And they can be really, really intense ridges. So I've seen a lessening of ridges over time with patients where we're working with a mineral supplement, or possibly and or working with stomach acid if it seemed like that was indicated as well. So that it is something that I think can get better. I mean, I was thinking about this, prior to hitting record on the video, and I was walking down the hall thinking like, what am I going to say in this video? Click my thoughts a little bit, and I was thinking like, I'm not sure if I've had patients where they've had ridges on their nails, and then given enough time, their nails become 100% perfectly smooth. I'm not sure about that. So yeah, just not 100% sure. Maybe, but I wouldn't be able to say for sure off the cuff. Again, it's not usually something that's like a major focus, but it'd be more like oh, how are those fingernail ridges doing? Like, oh yeah, they're not as pronounced, but not really taking before and after photos per se. Speaking from personal experience, I do have ridges on my fingernails, and I feel like they have got better over time. They've never been super pronounced, but I feel like as my digestive health improved over time, used to have some pretty debilitating chronic digestive issues in my earlier years. I feel like my nails have been less ridgy over time. But the one thing I'll just kind of wanted to add into this conversation here, because if I posted this video, say, I don't know, 6 months ago, I would have probably just left it there. But what I did want to add is that I think that there's a role for sulfur to play in nail integrity. I've posted maybe a little bit, no dedicated videos yet that I recall, to sulfur deficiency, but it's something that I've been working with in practice extensively for the last several months. I learned about this through this naturopathic doctor from Washington State. Her name's Kathleen Janelle. hoping to have her on my podcast soon, actually. We're just kind of hammering out dates right now. And she's been sort of, I don't know if pioneering is the right word, because I believe she learned about it from someone else, but she's definitely been perpetuating the use of this high-dose sulfur therapy, which basically involves taking MSM, methyl sulfonylmethane, to help correct sulfur deficiency. So I've been working with a high-dose sulfur protocol now for a few months anyways. I don't remember exactly when I started it, but I was just looking at my nails before doing this videos. I hadn't really been thinking about it a whole lot because my nails, I don't know, aside from trimming them, I don't really think about them a whole lot. I believe that they are even less ridgy, and so I'm thinking like, maybe there's something to that. Of course, it takes a while for a nail to fully grow out, so I don't know if I can really pass judgment on the sulfur piece until maybe another few more months have gone by. But I feel like my nails do seem less ridgy, and I've been the only real variable that I would say would have changed in the last few months has been taking this high-dose sulfur. So I'm wondering if that might be playing a role in this conversation as well. Sulfur is really interesting, I think, for a lot of different reasons, but as it relates to nail integrity, to my understanding, it's really important in creating disulfide bonds, so it helps to make the nails stronger but also flexible as well, which is kind of an interesting juxtaposition. But to my understanding, a good example in nature is a pelican's beak. My understanding is a pelican's beak has a lot of disulfide bonds in it, and that's what allows it to be flexible enough to expand when it's full of fish and water and whatever the heck else they put in there, and then. But then it also has a lot of strength to it as well. It's not going to burst with too much water or too many fish in there. The disulfide bonds give that mix of like strength and elasticity. Our ligaments and tendons are also rich in disulfide bonds, which again should have lots of strength and elasticity, or at least we hope that they will. Otherwise, they're going to get injured, strained, sprained, snapped, all these things. So, anyways, I'm going to post more videos about sulfur and slash high dose sulfur therapy soonish. Just haven't got around to it yet, but it does make sense that the sulfur would play an important role in helping to mitigate nail ridges, because I believe that the nail ridges would be maybe an indication of there's like a bit more like frailty, or almost like what's the word I'm looking for? Almost like it's affecting the pliability of the nail. So instead of having that nice smooth surface, it's kind of becoming a bit more rigid, essentially, or a bit more contracted. Because I don't know that I've ever seen a child with nail ridges, or maybe I have seen some, but like definitely never as pronounced as in an adult. And even as this person asking the question was saying like, oh, I'm starting to notice that I'm getting some on my toenails. It's like, okay, well, they weren't there before, so what's going on now? So if it's something that's maybe developing over time with not getting enough sulfur down the hatch. So anyways, stay tuned for more talks about sulfur, and maybe I will have a fingernail update in 3 more months and let everybody know if I have nice, perfectly smooth, non-ridged nails at that time, given more MSM. So we'll see. I think that's all I want to share on this. So if anybody has any further questions on nails or ridges or MSM or anything like that, just post in the comment section below. And of course, any questions about anything else, post in the comment section below, and I will do my best to answer as soon as I can.